This year, with the pandemic hopefully behind us, the expectations are more inclined towards the promotion of the research and development ecosystem within the country. We are looking at, in terms of the recommendations which we sent to the government, a 2x kind of waiver on the investments in terms of the tax benefits which we expect, because I think that fiscal incentive would be very, very important for a lot of industry members to kind of invest back into research and within the country. Our members are currently definitely investing in research within the country, and this can definitely give a high impetus to the industry, both for the domestic and the global pharma companies to invest in R&D, which is again in line with the thinking of the government. The second ask which we have is that there are certain tax benefits which are apparently ceasing in March 23 on the import of free samples which are given to the patients. That is something which we would like to see it extended for at least another 3 to 4 years. So these are the two major asks of the budget as we have put in our recommendations on. The customs duty extension is definitely something which we are looking forward to. And so far as 2x kind of an investment going into R&D being waived away is also a direct tax incentive which the industry looks forward to.
I think anything that makes healthcare more accessible, more affordable, will always be the priority for the union government. The GST rate in digital health is at 18%, whereas the rate in offline services or in-person services is lower. And I do expect that there'll be some thought towards how to rationalize this, because digital healthcare services improve patient outcomes and reduces the burden on physical infrastructure.
We believe that the 2023 budget will have an increased collaboration between the government and the pharma industry. Since the outbreak of COVID-19 pandemic, with an increased focus on healthcare as a part of the budget, there is a need to allocate separate funds for R&D in the formulation and API business. This will help boost cost competitiveness, increased innovations, and ramp up production. Subsidy on operational expenditures is also required by this sector, especially the electricity, manpower cost, and some other expenses. Government also has a role to play in terms of expanding the PLI scheme to enable more Indian manufacturers to access the incentive and provide boost to the API sector. R&D being a special focus in the sector needs the earlier deduction of Section 35(2)(ab to come back, which was 200% of the spend in the OPEX and CAPEX other than land and building. The API business should also be exempted from GST on the input and output side, which will help the industry grow and which is in line with the Atmanirbhar Bharat. The last 2 years have seen unprecedented healthcare situation, and which is followed by supply chain disruptions. We expect that the healthcare budget will increase given the size of the country and our population.
No country can be an advanced country without universal healthcare to all sections of the population. Every year during the budget, we talk about healthcare budget, but unfortunately, right now, it is a very small percentage, 2.5% of the GDP. First thing we need to do is we spend only approximately $70 or $75 per person compared to $10,000 in US, $5,000 in Europe. It is high time we increase the GDP so that we at least put in around 150 rupees per dollars per person for healthcare. This is a must. So accordingly, the percentage has to increase. Second is we have to bring universal healthcare. When countries like Brazil and others have done, why can't we do? What universal healthcare means, for all diseases, all sections of the population are covered irrespective of the socio-economic status, and it is unlimited. That way each disease can be treated properly, at the time. And this is been various models are presented. India is a young population, and with that we can collect a health cess and add to the extra tax we are generating each year, use that extra tax also for healthcare endowments so that this can be executed properly. Third is we always talk about prevention. I know there is a totally ban on tobacco is a very important thing. If they cannot ban, at least excessive tax, and whatever tax is collected from tobacco and nicotine and other areas, could chewing, all of this nicotine could be used for treating patients who suffer from this illness because of it. So there should be a separate endowment for this. So these are primary areas we should work on, and I hope we can achieve this in this coming budget.
We do have a list too. We believe that the government must solve input credit issue for hospitals on GST. Otherwise, the burden is getting passed on to the patients. The government must fix the payment and pricing problem with government health schemes. And the cost of medical equipments, imported medical equipments, is very high, compounded by the currency fluctuations. So more incentives for Make in India. But in this clamor of many things that the government can do, we want to call out what the government must do. India's population growth rate, as per Jankari, is 0.92%. Even if 50,000 doctors are added annually, there will only be 11.6 lakh doctors practicing by 2032, which would imply a doctor-patient ratio of 0.76 per thousand, as per Jankaria. We need more doctors and nurses. The government has to simplify our medical education system, invest behind it so that we are able to create more medical professionals in this country. Secondly, the primary healthcare and community health centers in rural areas have to be strengthened.
Giving my views and observations on the expectations that healthcare has from the government in the upcoming union budget, which is set to be presented on the 1st of February. Just before I start on healthcare, I think so the government has done a wonderful job in trying to push growth, control inflation, which has made India the fastest growing economy in the world at this point in time. And we continue to expect the government to walk the thin line of controlling inflation, having a close eye on the forex reserves that we have, and continue to drive growth by spending on infrastructure and making India ease of doing business much better. As far as healthcare is concerned, healthcare has been growing very well. It has grown more than 15% CAGR in the last 5 years, and I don't expect this to slow down in the next foreseeable future, at least 15% plus CAGR in the next 5 years. And we are really hoping that the government continues to partner and nurture the sector. And as a prelude to that, the first step could be actually to, make healthcare as a priority sector. This has been a long-standing demand, especially from the hospital sector, to make healthcare as a priority sector.
During COVID, we have all seen how we have faced the healthcare shortage in the country. There is not only need to augment the healthcare infrastructure in the country, but also to increase the medical education, where to meet the growing need of doctors and the nurses. For that, government need to allocate more fund in the forthcoming budget, nearer to its target of 2.5% of GDP. Government should also encourage private sector to invest more in the healthcare industry by providing them incentive like interest-free loans, soft loans with a longer tenure, because healthcare is generally a long gestation period projects. They should also encourage private sector to invest in the medical education for more private medical colleges. and GST regime need to be relooked again. Currently, healthcare industry not eligible for input credit, and that is a major drawback for the healthcare industry, because most of the services industry is paying taxes without getting any input credit benefit. Government should allow refund of the tax paid on the healthcare services to make healthcare services more affordable to the general public. There is also a need to relook the tax on the import of medical equipment and life saving drugs, because most of the healthcare equipments are imported from outside, and similar is the case for the drugs. And this will really help in augmenting the healthcare in the country. Government should also invest more for bringing the need for preventive healthcare. They should not only spend resources to educate people about the need for the preventive healthcare, but also they should also provide some benefit to the general public for opting for the preventing healthcare. Currently, as under the Income Tax Act, there is a tax benefit of 5,000 rupees on the preventive healthcare, which should be increased to 10,000 rupees. Another area which government should focus on the medical tourism. This is a big opportunity for the country like us, where we have a good infrastructure, and we can really utilize that infrastructure by encouraging the patient, by encouraging patient from the outside the country. There is a lot of things government can do, including visa on arrival, including tax benefit to the private healthcare providers, and making healthcare available